Welcome to today's health overview, where we'll be exploring epididymal cysts. We'll delve into what they are, what causes them, how they're diagnosed, and what treatment options are available. Understanding this common condition can empower you to take proactive steps for your health and well-being. The exact cause of epididymal cysts remains somewhat elusive, but several factors are thought to contribute. Obstruction of the epididymal ducts is a primary suspect, leading to fluid accumulation. Trauma or inflammation in the scrotum might also play a role. In some instances, congenital abnormalities can predispose individuals to developing these cysts. It's important to note that in many cases, the specific trigger remains unknown, emphasizing the complex nature of this condition. Pathophysiologically, an epididymal cyst arises from a blockage within the epididymis, a tightly coiled tube located behind the testicle. This blockage disrupts the normal flow of fluid through the epididymis, causing it to accumulate and form a cyst. The cyst is essentially a sac filled with clear, serous fluid. While the cyst itself is typically benign, its presence can sometimes cause discomfort or concern, prompting medical evaluation. Epididymal cysts are relatively common, affecting a significant portion of the male population. They can occur at any age, but are most frequently diagnosed in men between the ages of 20 and 40. Prevalence studies suggest that a substantial percentage of men will develop an epididymal cyst at some point in their lives. It's worth noting that many cysts are small and asymptomatic, meaning they go unnoticed and undiagnosed. Many epididymal cysts are asymptomatic, meaning they cause no noticeable symptoms. However, when symptoms do occur, they can include a small, smooth lump in the scrotum, located behind or above the testicle. This lump may be tender to the touch. Some individuals may experience a dull ache or feeling of heaviness in the scrotum. The size of the cyst can fluctuate over time. It's important to differentiate these symptoms from those of more serious conditions like testicular cancer, which necessitates prompt medical attention. Diagnosis of an epididymal cyst typically involves a physical examination by a healthcare professional. The doctor will palpate the scrotum to assess the size, location, and consistency of any lumps. Transillumination, shining a light through the scrotum, can help differentiate a fluid-filled cyst from a solid mass. In some cases, an ultrasound may be ordered to confirm the diagnosis and rule out other potential causes of scrotal swelling. Ultrasound imaging provides a detailed view of the testicles and surrounding structures. While epididymal cysts don't typically fall into distinct categories, it's helpful to differentiate them based on size and symptomatic status. Small, asymptomatic cysts often require no treatment. Larger, symptomatic cysts, on the other hand, may warrant intervention. Some physicians may also differentiate between single and multiple cysts within the epididymis. The classification, however, usually hinges on the clinical presentation and the impact on the patient's quality of life. Treatment for epididymal cysts depends on the severity of symptoms. Many small, asymptomatic cysts require no treatment at all. For larger, symptomatic cysts, several options are available. Pain relievers such as ibuprofen or acetaminophen can help manage discomfort. Wearing supportive underwear can also provide relief. In more severe cases, surgical removal of the cyst, known as a hydrocelectomy, may be considered. Another option is sclerotherapy, which involves injecting a sclerosing agent into the cyst to shrink it. Aspiration to remove the fluid, whilst easier than surgery, is more likely to cause cyst reformation. Currently, there are no specific preventive measures known to completely eliminate the risk of developing epididymal cysts. However, wearing protective gear during activities that could lead to scrotal trauma may be beneficial. Prompt treatment of any infections or inflammation in the scrotum could also potentially reduce the risk. Regular self-exams can help identify any abnormalities early on, prompting timely medical evaluation. The prognosis for epididymal cysts is generally excellent. Most cysts are benign and do not pose a threat to overall health. Treatment, when necessary, is typically effective in relieving symptoms. In some cases, cysts may recur after treatment, but this is relatively uncommon. Recent research is focusing on developing less invasive treatment options and improving our understanding of the underlying causes of these cysts.